Hi, and welcome to our presentation on COVID reinfections. My name is Megan Carmilani, and I'm the founder and president of Long COVID Families. With us today, we have Dr. Megan Fitzgerald. Megan, would you like to introduce yourself?
Yeah, hi, I'm Megan Fitzgerald. I have a PhD in Neuroscience and Neurology, and I'm a long COVID patient. My life and my career were interrupted in March of 2020 when I contracted COVID and subsequently long COVID, which got me involved with the patient-led research coalition on COVID-19. So that's my story.
Thank you. All right, so Megan's kind enough to join us today to answer a series of questions about reinfections. All right, thank you, Megan. So let's start with, can you explain how we've become immune to different viruses, either through vaccines or through gaining natural immunity due to infection?
Sure. The first time our bodies encounter a new virus that we've never seen before, we rely on something called our innate immune system to fight it off. This is a very inflammatory response that's pretty nonspecific. However, that first infection creates a memory in our immune system, so that the next time we encounter the same pathogen, our immune system is ready to fight it in a much more specific and efficient way, even neutralizing this threat sometimes before we experience any symptoms. Our immune memory is a pretty amazing thing. Some of the cells responsible for creating this immune response are even called memory cells, memory T cells and memory B cells, which help produce antibodies. Immune memory is actually first described thousands of years ago during the plague of Athens, when it was written that those who became ill but survived the first wave of the plague could care for people who became ill in subsequent waves without becoming sick themselves. And thankfully, in more modern times, we've learned to harness the power of immune memory using vaccines. So we don't even have to become ill to develop immunity to some really dangerous diseases. Unfortunately, the reason that we're having this panel here today on COVID reinfection is because COVID is escaping this powerful component of our immune systems. And unlike with many other viruses, we aren't fully immune after infection or after vaccinations.
Might I ask a clarifying question? So just to be clear, so when we say somebody is immune or we have immunity, do we mean that we cannot get the virus, or there's different levels of immunity?
There's different levels of immunity.
Okay.
Yeah.
Okay, thank you. And for COVID, we do not have full broad immunity.
Exactly. For something, I'll use the measles as an example. After you get measles or you get a measles vaccination, you have something called sterilizing immunity. So you're fully immune. You don't have symptoms of the disease and you can't pass on the disease anymore. With COVID, that's not the case.
I see. Okay. So then you can get COVID more than once.
Yes, you can absolutely get COVID more than once, and reinfections are becoming increasingly common.
Okay. And this is true even if you're vaccinated or boosted?
Yeah, unfortunately, even people who've been vaccinated and boosted can get COVID and can get it more than once. You can also spread COVID even if you've been vaxxed and boosted. The vaccines did an excellent job when they were first developed, protecting against infection from the ancestral strain of COVID, which was the first variant of the virus that we experienced during the spring of 2020. Vaccines reduce the chance that you'd catch this virus during this time, experience any symptoms at all, and they even reduce the chance that you could spread COVID. But then in the Delta wave, we had vaccines plus booster shots still provided good protection from symptomatic illness from COVID. But now in the Omicron era, it's pretty common to become ill with COVID, even if you've been vaxxed and boosted on schedule. And vaccines still provide a degree of protection from severe disease. So going back to your question, we have some immunity to it. But it's obviously important, but they don't prevent us from experiencing symptoms of COVID or from spreading COVID to other people.
So can you explain why do COVID reinfections happen? And how is it escaping our immune memory?
The main problem is that COVID is evolving to escape our immune memory. The virus has a component called the spike protein, and this spike protein is the key to the virus invading the cells in our bodies. Mutations in the spike protein can make the virus less recognizable to our immune system. So you can imagine like our immune systems are security guards to our body, and they're trained to recognize a specific person. And now imagine that person grows a beard, puts on a wig and hat and sunglasses, and at the same time gets better at sneaking past the security guards. And metaphorically speaking, of course, this is what COVID is doing really well. The virus is circulating at high levels in our society, and because of this, it has plenty of chances to mutate into variants that are better able to escape our immune memory.
So early on in the pandemic, we heard a lot about herd immunity. So is it possible? Can we achieve herd immunity from COVID? And how does that compare to other diseases?
So herd immunity is the idea that we as a population can become immune to a disease, and this will stop the spread of the disease. Herd immunity can be achieved either through infection or through vaccination. And herd immunity is a pretty amazing thing. It can even protect vulnerable people, because when the majority of a population is immune, even if the vulnerable people can't themselves mount a great immune response, herd immunity can stop the viruses from circulating in the population, so it protects the vulnerable as well. So that's why in the beginning of the pandemic, a lot of politicians were hopeful that, once enough people contracted COVID and they recovered from it, we would achieve herd immunity, and that would stop COVID and protect the vulnerable. But unfortunately, COVID is just not behaving that way. And we've stopped a lot of other dangerous diseases with herd immunity, and we got there safely through vaccination, including measles, mumps, whooping cough, diphtheria, and some others. But I'll say we don't have herd immunity to everything, every virus. We don't get immunity to the common cold, which is caused by the 4 circulating coronaviruses that we had prior to COVID, despite the fact that we are repeatedly exposed to these viruses. These coronaviruses that cause the common cold, they're cousins to COVID-19, and like COVID-19, they dodge our immune defenses, and we can be infected and reinfected with them time and again, even though they're much less harmful than COVID-19 on our bodies. So not every virus can be stopped through herd immunity following natural infection. And unfortunately for us, the coronavirus family seems to be pretty adept at evading our immune defenses.
Okay. So then how common is it to get COVID more than once?
That's a really hard question to answer because reinfections are not being tracked systemically, but I can confidently say that COVID reinfections are fairly common.
Yeah, follow-up question to that, would you necessarily know you've been reinfected unless you were tested, right?
Yeah, you might not know because you can have an asymptomatic or a very mild asymptomatic reinfection.
Okay. Sorry, I touched my screen and it went too far. So then, are the second and third infections of COVID possibly milder though?
So this is a narrative that I'm seeing in the media right now, but it's not always the case.
Okay.
One of the earliest studies that were published on COVID reinfections back in December of 2020 showed that second infections with COVID could be more serious than the first infections. They could be less serious. It was basically just a roll of the dice. Whether the infection was more serious or not. But at that point of the pandemic, reinfections, even though they could be serious, were very rare, both because we were taking collective measures as a society to mitigate the spread of COVID, and because we didn't yet have the super contagious immune evasive variants that we're dealing with today. So the early data that was showing that reinfections were rare, but that previous infections with the virus didn't do a great job at lessening the severity of the reinfection. But the landscape today looks different. We have vaccinations and boosters that absolutely mitigate the severity of infections, and we're in the Omicron era. We know that the Omicron variants are thankfully less likely to cause severe complications in the acute phase of the disease than the viral variants that came before. And so I know that today a lot of pundits and public health professionals are saying that reinfections are generally milder than the first infection, but I think it's still an open question as to whether this is due to the milder variants that are currently circulating. For example, if you had a Delta infection and then an Omicron infection, the Delta infection might have been more severe as a property of the virus, not because the Omicron was the reinfection, it's just that Omicron is a more mild virus. Or whether the more mild reinfections we're seeing are due to the milder variants. Plus, vaccinations and boosters, or whether all of these are contributing factors. The other thing that you need to keep in mind with this question is how badly people were impacted by their first COVID infection. COVID is a potentially severe virus, and even a mild first infection can leave people with worsened pre-existing conditions or with new health conditions like long COVID, which can include problems ranging from brain fog to heart and lung conditions and new autoimmune diseases. So if someone develops these conditions following a first COVID infection, a second COVID infection can impact them quite severely. So I would say COVID infections are not always more mild than first infection.
Okay. So then are there long-term consequences just simply from being reinfected?
There seem to be, at least for some people. A large study was conducted and released earlier this month using data from the VA hospital system. And for people who aren't familiar, the VA, or Veterans Affairs system, provides healthcare to many of America's veterans. This study looked at the health records of about 250,000 people who had one COVID infection and about 35,000 people who had been reinfected with COVID, sometimes multiple times. And they found that the people who were reinfected, so they had 2 or more COVID infections, had twice the risk of dying of any cause, as well as twice the risk of heart and lung problems, as compared to the group that had only been infected with COVID one time. And with each reinfection, the risks grew larger. So the reinfected population also had higher risks of long COVID symptoms like fatigue and digestive issues. This study's been criticized somewhat because the population it looked at was mostly older, over 60 years old, and male, because this is the population that the VA hospital system principally serves. So some critics have wondered if these findings would apply to younger people, but I don't think anyone can really argue with the take-home message of this study, which is that it's better to avoid reinfection.
Okay, so what it sounds like is that there's likely, or possibly at least, a compound effect. Is that an accurate way to say it? Because I've heard it described that way. And then I've heard that debated. So just wanted to clarify that.
I don't think we have quite the data to show that,
Okay.
but it could also be a compounding effect in some people and not in other people. So there's unique individual vulnerabilities to this that, we don't know what's causing that at this point.
Okay, but bottom line, it's good to avoid reinfection.
Yeah.
Okay. So then are kids at risk for COVID reinfection?
Yes, children are at risk from reinfection from COVID. I mean, children have great immune systems and they're at lower risk for severe complications from acute COVID infection, at least when compared to adults and elderly people. But because we send our kids to schools and because most schools have dropped COVID mitigation measures, kids are frequently becoming reinfected, sometimes within quite a short time frame, only a couple of months, sometimes with only a couple of weeks.
Wow. Okay. So what is the risk of developing long COVID from COVID reinfections versus the first infection? So if we've had COVID once and didn't develop long COVID, then am I good? Am I in the clear?
We don't have the data yet on the risk of this happening. It's definitely happened to some people where they recovered successfully from their first bout with the virus, and then a subsequent infection left them struggling with symptoms of long COVID. But I don't have data on what the odds are of this happening, and I don't think anyone does right now. But basically, while it's great if you recover quickly from a first bout with COVID, there's no guarantee that you're not going to develop long COVID on a subsequent infection.
Okay. So then the best thing is just to avoid reinfection or infection generally, but to definitely avoid reinfection. So then my next question would be, do masks, which would help with that, actually harm natural immunity though, by preventing exposure to viruses?
So natural immunity to other viruses that are circulating. Yeah. There's really no evidence that masks can somehow have a bad impact on our immune systems or long-term health. As a matter of fact, Japanese people routinely wear face masks to prevent the spread of diseases and have done so before COVID, and they have the longest life expectancy of any country in the world. And regarding exposure to viruses, and speaking, as a mother right now as well, my son attended kindergarten last year in a public school in Philadelphia. He wore his mask. He did a fantastic job wearing it. And although his mask wearing prevented us from getting COVID and the flu, he still picked up a lot of other viruses that were going around, colds, bronchitis, and probably because this was spread on surfaces. And masks only protect against the spread of airborne illnesses like COVID. So kids have plenty of other chances to get exposed to viruses and bacteria, especially if they're in a congregate setting like a school or a daycare classroom. And if we want to boost kids' immune systems and their microbiomes, there's a lot of healthy ways to do this. You can expose them to healthy bacteria, like in yogurt, keep them up to date with their vaccines, feed them a healthy diet with some homegrown, ideally, or locally grown fruit and vegetables, play outside, get a pet, don't use antibiotics unless you really need to. These are kind of all proven ways that we can look after our kids' immune systems. Exposing kids to COVID doesn't boost their immune systems. Contracting COVID, even for kids, can be really dangerous. We have a kind of a pervasive myth in America that if it doesn't kill you, it makes you stronger. And that's really not the case with dangerous diseases, including not only COVID, but other viruses like the measles as well. And these viruses can actually weaken our immune system. So it's worth doing what we can to protect our kids and our families right now. And that includes masking.
Okay. So my next question is, I've heard the term, right, multiple hit theory. So what do we mean by multiple hit theory of post-infectious illness? And how does that apply to long COVID?
The multi-hit hypothesis of chronic disease speculates that genetic or environmental factors can prime the pump, so to speak, to make someone more vulnerable to developing a post-infectious illness like long COVID. So these environmental factors can include anything that places significant stress on the body, and that includes past exposure to other viruses. We don't know yet whether COVID reinfection can in and of itself be that multiple hit combination that contributes to long COVID, but that large VA study that I was just talking about suggests that it might be.
Okay. So along with that, I'm hearing then that COVID can actually reactivate viruses. What does that mean? And what's the difference between a reinfection and a reactivation?
A reinfection is a new infection with the same disease. And that's what's happening with COVID. So that's what we've been talking about so far. Okay. And a reactivation is when a virus lies dormant in the body after an infection and people can become symptomatic again, usually after a certain trigger. And COVID can be that trigger, causing latent viruses in the body to become active again. The two most common viruses that are being reported being reactivated following COVID are mono, or Epstein-Barr, and herpes zoster, which causes chickenpox and shingles. So some people who have had a COVID infection and are recovering are suddenly faced with the symptoms of mono and shingles because those viruses have become reactivated. Those are both viruses that lay dormant in the body because after we're infected with mono or chickenpox, we never really clear these viruses from our bodies. And when they're reactivated, they can lead to symptoms of that disease. And it's a topic of active research to determine how much viral reactivation contributes to long COVID and ME/CFS.
So is there anything we can really do to prevent reinfections?
Yeah, absolutely. I mean, for now, what we need to do collectively is to take actions to slow the spread of this virus. And this includes the tried and true methods we all used in the beginning of the pandemic, like social distancing and masking and testing and quarantining when we're sick. And I know we're all tired of doing this, right? But the Omicron family of COVID variants is just so contagious. And so when we're masking, it's worth investing in higher quality masks like the N95s or KN95s, or for kids, the KF94s, especially when you're in an indoor situation where other people aren't wearing masks. We need to be pushing urgently for better ventilation in indoor public spaces like schools, and hold gatherings outside whenever feasible. Even though it's still possible to contract Omicron outdoors, the likelihood of transmission is very much decreased. And, that's what we're shooting for here, just decrease spread. We can't stop it entirely at this point, but we can really decrease the spread and decrease the chances that we'll be reinfected with COVID.
So do you think we're going to end up masking forever?
I hope not. But I do think we need more tools to fight this virus before we can stop routinely masking indoors. And we really need to push our elected officials to invest in developing these tools. For instance, there's pan-coronavirus vaccines that are being researched that should work better against the multiple variants of COVID-19, as well as nasal vaccines that could potentially do a better job creating mucosal immunities and stopping the virus before it can really invade our bodies, and can possibly better protect us from infection. But the development of this new generation of vaccines just doesn't have the resources or the urgency that was put into Operation Warp Speed to develop the first generation of COVID vaccinations. So I do hope, with these advancements, we'll be able to eventually truly safely get back to normal.
So thank you for that. And then at the beginning, when you introduced yourself, you told us you were a part of patient-led. Can you tell me more about what patient-led is doing to study COVID reinfection?
Yeah, so I'm working with patient-led on a research project to study the impact of reinfections on long COVID. And we're going to be conducting survey-based research in the patient community. We've recently received funding from Balvi, from the Balvi Fund, and we're in the study design phase of our reinfection study. We'd love to hear from the patient community. What questions surrounding reinfection are the most important to you and your family and your community? What do you think we should be looking at? Our team's email address is team@patientledresearch.com. So, feel free to get back to us if you have thoughts on this.
Great. All right, Megan, thank you for sitting with me today and answering some questions.
Yeah.
What we're going to do now is we're going to shift to a live Q&A. All right, so stay with us. Thank you.